Imagine having struggled with diabetes for years, then you come across someone claiming it can be cured in just 30 days. From the fear of its complications like blindness, heart diseases, chronic kidney disease, nerve damage, diabetic foot, and many more, you immediately establish hope from an online expert who can use detoxes, herbs, and diet restrictive practices to completely cure diabetes. Is it another dangerously propagated internet myth, or is diabetes really reversible? My name is Reagan. I'm a medical clinician and a clinical researcher with a focus on diabetes, metabolic health, and emergency medicine. In my daily practice, I manage and follow up patients living with diabetes and other chronic conditions. So what I'm sharing with you is not just theory, but real practical experience from the front line of patient care. If you're serious about understanding your health, preventing disease, and practicing smarter medicine, please hit the subscribe button now and join this community. In this video, you'll discover whether diabetes can be reversed or not, what remission actually means, lifestyle strategies towards remission supported by scientific evidence, and common myths about the reversibility of diabetes. Let's get into it after the short introduction.
Lakini jangwani si mahali pa kuangamia, ni darasa la mbingu la kutuponya roho. Moyo wa mwanadamu hukumbuka raha ya jana na kusahau utumwa uliomkaza kwa kamba, kwa sababu ya hofu ya kesho isiyoonekana. Lakini jangwani si mahali pa kuangamia, ni darasa la mbingu la kutuponya roho.
So first, the most fundamental concern in this video is, can diabetes be reversed? As we discuss the reversibility of diabetes, it is important to note that this conversation only applies to type 2 diabetes. Type 1 diabetes is currently deemed irreversible due to the fact that it involves autoimmune destruction of the pancreatic beta cells that usually produce insulin. As a result, there is an absolute insulin deficiency. Patients with type 1 diabetes are therefore insulin dependent. However, ongoing research by global organizations such as the Juvenile Diabetes Research Foundation continues to explore promising treatment alternatives, which include but not limited to immunotherapy, stem cell therapy, and artificial pancreas technology. Ongoing evidence-based studies are promising for future breakthroughs, but none have yet proven effective in curing type 1 diabetes. So, can type 2 diabetes be reversed? The answer to this question is hopeful, but also more complicated than most people think. First of all, the term reversal is a layman's term. The correct word is remission. According to the American Diabetes Association, the definition of remission is blood glucose level that is below the normal diabetic range for at least 3 consecutive months without using any blood glucose lowering medication. The Diabetes Care Journal also published a systematic review that established that intensive lifestyle interventions are significant contributors to improved remission rates among patients with type 2 diabetes. A person is qualified to be in remission when 3 things occur, and the first of them is when HbA1c drops below 6.5, and at the same time the patient has not been using any blood glucose lowering medications, and lastly when that HbA1c lasts at that range below 6.5 for more than 3 months. So when all these 3 criteria are met, then this person is qualified to be in remission. Remission is not a permanent cure, and I know most of you are already asking, why is remission not a permanent cure? Yes, that's what I'm answering you next. Remission is not a permanent cure for diabetes because the disease is not permanently eliminated. It can be perfectly controlled with lifestyle interventions. So the difference between remission and cure is that in cure there is no future risk of relapse, while in remission there is an imminent risk of recurrence if healthy lifestyle practices are not followed. Continuous follow-up is therefore required to detect and prevent any form of relapse. Even after confirmation of remission, it is important to note that when insulin resistance may persist for diabetic patients, again, lifelong lifestyle management is very, very necessary. And the last part is that weight gain may trigger recurrence. The other fundamental concern I want to address is whether weight loss can reverse type 2 diabetes. So can weight loss reverse type 2 diabetes? Well, research studies suggest that 10 to 15% weight reduction increases the likelihood of diabetes remission. Excessive accumulation of fats in the pancreas and the liver usually plays a key role in type 2 diabetes. With substantial weight reduction, liver fat is usually reduced and pancreatic function also improves. And lastly, insulin sensitivity may also increase. And when all these happen, then the most resultant effect is that blood glucose will return to normal range, and that presents a possibility for diabetes remission. Let's also address some of the lifestyle changes that can help achieve remission of type 2 diabetes. Among lifestyle changes that can help in achieving remission are the following. First is healthy eating habits. Proper nutrition, we have addressed this. It's called the Mediterranean diet. We have addressed this about food and eating in diabetes in many videos you can check. Also, you need to improve physical activity. We also did this in lifestyle management. And regular blood sugar monitoring is not a choice. If you're diabetic, the best practice you can ever do to yourself is ensure that you do regular screening, because it enhances early diagnosis and that will help in achieving better outcomes. Also ensure that you have better stress and sleep control. Better sleeping habits help in controlling cortisol levels, and that reduces the chances of you suffering diabetes. So what are some of the myths about diabetes reversal? This is a very important part that I would like us to also address. The following are the common myths and misinformation about diabetes remission. First is that there is an instant cure to diabetes. This is a lie. There is no scientifically verified overnight cure for diabetes. Be careful about those who sell to you miraculous supplements and herbal remedies, detox teas, and many unverified social media information about this. The second myth is that herbal remedies can exclusively reverse diabetes. The reality is no single herbal product has proven to cure diabetes. Relying on herbal remedies may delay your life-saving treatment. The third myth is that diabetes goes forever once blood sugar improves. In reality, weight gain and poor lifestyle habits may worsen blood sugar again. The fourth myth is that only obese and overweight people get type 2 diabetes. While overweight and obesity are truly risk factors, even lean individuals with normal to low BMIs can be diagnosed with diabetes because of visceral fat distribution, ethnicity, family history, genetics, and many other factors. So do not be deceived about this. And the last myth I'm giving you today is that taking diabetes medications means failure in management. Medications prevent glucotoxicity, prevent organ damage, improve quality of life, reduce complications, and eventually saves millions of lives. The last part I want us to address is why diabetes remission matters. Remission is a significant step forward because it reduces the risk of kidney disease, stroke, heart diseases, visual complications, sexual malfunction, neuropathy, and many other diabetic complications. Remission also improves mobility, energy, mental wellness, and the quality of life of diabetic patients. In my final thoughts, I dare ask again, can diabetes type 2 be reversed? Well, the answer is diabetes type 2 remission is very possible, especially if diagnosed early and if the patient adheres to lifelong lifestyle modification practices such as proper nutrition, weight management, and regular physical activity. However, remission is not a permanent cure. As a result, follow-up must continue. Instead of quick fixes, consider sustainable habits. A change in lifestyle significantly transforms diabetic outcomes. If this video gave you clarity, if it challenged how you think about diabetes and its remission, please subscribe now, because this channel is all about helping you stay ahead of the disease and not reacting to it. Share this with someone who may need it, because you might just change their life. Diabetes doesn't start in the emergency room. It starts silently, and the earlier you look, the more you can change the outcome. Thank you.
Lakini jangwani si mahali pa kuangamia, ni darasa la mbingu la kutuponya roho.